So, hi everyone. Thank you for joining us tonight. My name is Taylor Mead, and I am the Director of Health Programs for Special Olympics New York. For those that are new to our health and wellness forums, these are a space for people with intellectual disabilities, for their caregivers, for their families, for healthcare providers to be able to come together and learn some very important information regarding the health of people with intellectual disabilities. So our goal is to make these an accessible offering that touch on really topical items when it comes to the health of people with ID. And I think those of you that are joining us tonight very much agree that tonight's conversation is very topical when we're talking about the health of people with intellectual disabilities. So we just want to take a moment to quick mention a few housekeeping items. So please keep yourself muted while the presentation is going on. We will have the opportunity at the end to ask some questions. If you are uncomfortable asking your question tonight, I will also provide a link in the chat to be able to submit a question after the presentation is over, and then I can forward that on to our presenters tonight or answer the question myself if it's something to do specifically with Special Olympics New York and our health work. So without further ado, I'm going to introduce our speakers tonight. So we are joined tonight by Dr. Raquel Rozdolski and Dr. Susan DiSenso. So Dr. Rozdolski is a board-certified dentist anesthesiologist. She is a clinical assistant professor of dental medicine, the director of anesthesia and pain control, and co-director of the Special Needs Dentistry Fellowship at the Touro College of Dental Medicine. At the College of Dental Medicine, she's the dedicated anesthesia provider, and Dr. Rozdolski oversees all procedures requiring sedation, bringing her expertise and years of experience to each case. She also provided sedation at the Rose F. Kennedy Center for children and adults with intellectual and developmental disabilities. Dr. Rozdolski also serves as the faculty of the School of Medicine at Mount Sinai and is on the medical staff of the Department of Pediatric Dentistry at the Mount Sinai Hospital, where she serves as anesthesiology attending. Dr. Rozdolski is incredibly active and passionate about organized dentistry and currently serves as the regional chair of the New York State Dental Health Planning and Hospital Dentistry Committee and serves on the New York State Medicaid Committee. At a local level, she serves on the Board of Governors of the 9th District Dental Association and is a delegate for the 9th District. She's an active member of the OPWDD Task Force for Special Dentistry in New York State. Deeply passionate about bridging the gap in access to care faced by those with intellectual and developmental disabilities, Dr. Rozdolski spearheaded the Smiles United project at TCDM, an innovative virtual model of care which aims to diminish the barriers to treatment individuals with IDD face in their access to care. Dr. Susan DiSenso is the Director of Special Needs at Touro College of Dental Medicine at New York Medical College. She joined the college in the spring of its opening year as an instructor of gross anatomy and head and neck anatomy for the inaugural class. At the time, she was practicing at the Westchester Institute for Human Development, an Article 28 clinic dedicated to providing comprehensive and continued dental care to persons with disabilities and remains in close collaboration. With experience in dental care for patients with intellectual, developmental, and acquired disabilities, she developed TCDM's Special Care Dental Education Program and serves as the course director for Oral Health Care for Patients with Special Needs rotation, the result of Dr. DiSenso's collaborative efforts in establishing an affiliation between TCDM and WID. The rotation provides dental students with a unique educational experience to work with individuals with developmental disabilities and their dental providers. Dr. DiSenso sits on the New York Academic Dental Center's Fellowship Advisory Committee, where she assisted in developing the fellowship and scholarship programs to address oral health disparities, supporting a fellow at each New York State dental school for training in special care dentistry. She is co-director of the fellowship at Touro. She also is co-architect and manager of the Touro Special Care Dentistry Continuing Education Series, with support from the OPWDD Task Force on Special Dentistry, a free live webinar series for multidisciplinary guest speakers to lecture on various challenges and opportunities in the care of individuals with intellectual, developmental, and acquired disabilities. In addition to her teaching responsibilities at Touro, Dr. DiSenso is an adjunct assistant professor of cell biology and anatomy in the School of Medicine at New York Medical College. So I am going to stop sharing my screen and give the floor to Dr. Rozdolski and Dr. DiSenso.
Thank you so much for those very generous introductions, Taylor. Thank you. Thank you. We're very happy to be here today with you all, and we thank you for your time this evening. As Taylor mentioned, we will be speaking about our Smiles United project with Touro College of Dental Medicine, which is a virtual model for delivery of oral health education to agencies. I'm Dr. Rozdolski, and you can see Dr. DiSenso over here as well. Just a quick, brief shout out too. I wanted to mention that we do have Dr. Marie Robles here on the call as well, and she was at the time a student when we initiated this project. She's now our current fellow for special care dentistry at Touro, though she's getting ready to graduate in July. And I also see one of our students, current students, Dorina, who's here as well. So if you guys have any questions for the two of them as well, they are here. So I just wanted to quickly introduce them as well. Okay, so an overview here is that, you know, I'm really preaching to the choir. I don't even think I need to say all of this, but I do want to mention that we are aware that people with ID are prone to poor oral health and have more complex oral health care needs than people without ID. In fact, 11% of individuals with ID have no teeth compared to 2% of the general population. This is, you know, related to decreased access to care and a generalized increased need for assistance that only potentiates all of the issues. A study from the American Academy of Pediatric Dentistry showed that of the 10% of people surveyed that were general dentists, they reported that they treated patients with special healthcare needs often or very often, whereas 70% reported that they rarely or never treat patients with special healthcare needs. So what is happening for individuals that require dentistry when they go out into the real world, if these dentists are unwilling to treat? They're getting, you know, referred from dentist to dentist to dentist until hopefully they find a dental home. So we wanted to figure out what we could do within the home to assist individuals themselves as well as their caregivers. And as we know, these disparities were only exacerbated with the COVID-19 pandemic. We know that the effects of the COVID-19 lockdown continued well beyond the lockdown itself. But during COVID-19, wheelchair-adapted vehicles and ambulances were transporting patients with COVID-19 to and from hospitals, and they were therefore unavailable for transportation to dental appointments and regular healthcare visits. Transportation supplied by the long-term care facilities were only being used for hospital visits that were mandatory. And then patients often require more frequent dental recalls for oral health care maintenance. And COVID-19 made these visits nearly impossible, only further increasing their already increased risk for oral health caries and disease, etc. Those with cognitive impairment or mental health issues, perhaps they have dementia or developmental disabilities, may not have been able to process the pandemic. I mean, all of us had challenges processing the pandemic, and it also resulted in changes in behaviors. Reactions could range from fear to physical aggression, leading to even less patients being able to be treated in an ambulatory setting. And when they were actually at a setting, their additional support people that accompanied patients were discouraged to be in the room because they were limiting the amount of individuals that could be present in a small area. We had increased PPE in the head and neck area that affected individuals that had limited hearing capacities, and patients who were deaf or needed lip reading suffered diminished or absent communications. The Surgeon General report for Oral Health in America, Advances and Challenges reported that untreated dental caries and permanent teeth affect 1 of 4 Americans aged 6 years and older, with no improvement since the 2000 report. 2 in 5 adults aged 30 and older have some form of gum disease, and prevalence is even higher for people aged 65 and older. The disparity in tooth retention among those 65 years and older between those living in poverty and those who are more affluent has nearly doubled in the past 20 years. We're getting worse. The report suggests that coordinated efforts among policymakers and key stakeholders are needed to mitigate the influences of these upstream determinants so as to improve the overall health and the oral health for millions of Americans. So we all have a lot of work to do, and we need to be working with our change makers, our policy makers, our stakeholders to figure out how do we improve this? Because the rate at which we are going right now is not in the right direction. So we will take all ideas necessary, and we are ready to advocate. But we have made one small step with our mission, and that is to diminish oral health care barriers and equip caregivers with educational resources on the importance of oral health and the delivery of oral hygiene care for individuals with ID. We focus on training caregivers of people with ID living in group homes via a virtual training module, with the goal of implementing caregiver training throughout New York State group homes during an on-board training. And all of these videos that we will speak about today are offered free in virtual video modules. We also know that factors affecting oral health and access to care, that individuals with ID have complex medical histories, physical, behavioral, and psychological challenges, reliance on others for daily home care if they aren't able to provide the care themselves, and reliance on others for transportations. We have lockdowns and quarantines. This really affects everybody, but to a greater degree, individuals with ID who can't get out and utilize the transportation that they normally have. There's also a high turnover rate of caregiver staff or direct support providers in group homes, which we found a significant turnover just in this small pilot study that we did. There's cultural diversity, poor reimbursement, lack of provider training, that's on the dentist's part, and lack of caregiver training. So Smiles United worked with the New York State Office for People with Developmental Disabilities. As many of you know, it's an agency that manages services for New York residents with developmental disabilities, about 130,000 individuals. We had support with Jill Pettinger. She's the deputy commissioner, and she assisted us in connecting virtually with OPWDD residences via Zoom and coordinated directly with nursing staff. We identified specific dental health care challenges that may occur in the group home setting, and then we confirmed availability of time and access to the internet so that the staff could watch the videos that we'll talk about. So I want to talk briefly about our partners that we worked with. I just mentioned the OPWDD. We have continued collaboration with the deputy commissioner, and we developed a 10-minute onboard training for all new hires that the OPWDD will be utilizing in their onboard training video modules. We also partnered with the Anderson Center for Autism, a nationally renowned autism service agency serving 500 children and adults with autism. They employ over 850 staff. They have 24 IRAs and 4 lifelong learning centers, 255 residents, and 270 DSPs. They are a lovely organization, and we worked very closely with them and their staff on the development of some of our more advanced videos that we will discuss going forward. We also worked and partnered with the Young Adult Institute, or YAI. They have New York City borough locations offering outpatient services, including primary care, dentistry, peds, etc., and residential services. So let's get to our oral health instructional videos. And if you see down here, you can scan that and take a peek while Dr. DiSenso starts going over everything. Dr. DiSenso, I'll let you take it over.
Thank you. So I'd like to walk you through the series of videos that we did put together, giving you a bit of a snapshot of what each of the videos encompasses. What we tried to do was ensure that we managed to get individual videos into sort of bite-sized pieces and manageable ways so that we could continue a series, but also be able to have the ability to have people select which ones they wanted to review them at different times throughout their opportunities and work sessions, so that maybe some videos would be about 4 minutes, others maybe up to about 10 minutes. So, you know, digestible. So I'll go to the next slide and start with what is my favorite of our videos. And Raquel, I'm not sure if you're able to go to the next slide. There we go. Okay. So we start our introduction video with the topic helping people with IDD overcome barriers to oral health treatment. So we do talk about the effects of poor oral health and hygiene on systemic health, psychological health, social health. And the reason that this is my favorite, and I'm sure it's Dr. Rozdolski's favorite as well, is that we were able to work with self-advocates and parents, specifically from the LEND program at WID, and they were able to share their personal experience and to talk about insights that they would want to provide to their caregivers. Things to remember on, you know, how to work with people and, you know, what's going to be successful, really from their perspective. And so it's if you don't look at any other videos, I would look at that one to start. And it's I think it just really segues well into what we're trying to accomplish here, because this is about people. Next slide, please. So our lesson 1 goes over the basics of oral hygiene. So we do want to talk about prevention as a key. We know that obviously if we're having upwards of 8 months to 5-year wait times, depending on where we are in the country, to get into an operating room, prevention is really a difficult thing. And so trying to get into the homes and help with at least helping people understand the importance, how do you appropriately brush, how to recognize disease and when to call for help, and how to, be an advocate for the individual that you're working with. Understanding what causes cavities. So how does diet affect oral health and hygiene? Increased dental risk for people with IDD compared to neurotypical individuals, and just recognition of disease, as I mentioned, when to really contact a dental professional if it's off the timing of their routine care. Lesson 2, we talk about tools of the trade and helpful substitutions. So we do go through the basics, toothbrushes, different toothpastes. We talk about different flavored toothpaste, because that could be an issue for some people. Sometimes the consistency is a little difficult. So just understanding the differences in that, different floss techniques, traditional floss versus different holders. We talk about mouth props to help assist, denture adhesive and denture care as well, because we do know that a lot of individuals may have dentures, and helping the individuals know how to care for them. But if they are not able to, making sure that their caregiver has an understanding of what to do, take it out at night, and how to care for it so that it's lasting and that you don't end up having infections in the denture itself. And then we talk about modifications of toothbrushes. We have an example here of a screenshot of our video of just how we can do adaptations if we want to assist with an individual who has mobility or dexterity issues so that they can modify the toothbrush to be able to be more comfortable to brush themselves. In lesson 3, we talk about instructions specific to the caregiver. So tips for individuals and caregivers. We do a bit in the beginning about how to brush your own teeth for those who are brushing their own teeth. And then caregivers understanding, because unless you've tried to do it before, it is different brushing someone else's teeth versus brushing your own teeth. So where to position yourself, how to support individuals, how to communicate, different toothbrush techniques. So there's different ways to move the toothbrush along the teeth and along the mouth, and some might be more successful than others for individuals. Flossing demonstrations, how to floss appropriately. And as I mentioned, positioning. And then we do go over very specific details on denture care, how to clean them, appropriate use of adhesives, etc. In lesson 4, we do behavior guidance techniques. So these are the techniques that have been successful with individuals to help graduate them to a particular task. So things like tell, show, do. You tell someone what you're going to do, you show them first, and then you do. So you can see an example of a screenshot in the image, showing someone on their finger first before moving into their mouth. Things like positive reinforcement and rewards, warnings about rewards that sometimes are food related and can be detrimental. So how do you deal with that then? Because we don't want to take away a reward that someone has gotten used to. So how do we segue into a different type of reward so that we're not increasing the risk? Things like counting techniques and distraction techniques and desensitization. Desensitization is a big one that can be very helpful. And then troubleshooting. So lesson 5 talks about troubleshooting common oral hygiene issues. So these are if we need to make modifications in positioning and head support, if an individual is not comfortable sitting in a chair, or if you do have them sitting in a wheelchair, or if they're even in a bedside that you need to provide. So how do you do support? Where do you sit? And different tips for aided toothbrushing in that perspective. And then we did get some feedback from our initial first rounds. And we certainly had people who wanted very specific modules since they were very happy with what they saw. They wanted to see some specifics that were focally discussing different types of disorders. And so rather than try to zoom in only on things like autistic spectrum disorder, cerebral palsy, we look at, some common concepts that you might see through the lens of autistic spectrum disorder, but it's not limited to autism, through the lens of cerebral palsy, but it's not limited to cerebral palsy as the only, muscular disorder. And so we talk about each of these in detail as well. So for our lesson 6 for the autistic spectrum disorder and oral care, we discuss behavioral disorders through the lens of autistic spectrum disorder, importance of utilizing an individualized oral home care routine to establish a complete oral hygiene routine. And that's something that we really stress for any individual. It has to be individualized. It's very easy to say these are the steps to brush your teeth, but for each individual, how you get each of those steps done might look a little bit different. And so you work with the person to figure out what's going to work best and be most comfortable and be the most efficient. So understanding also social and behavioral challenges associated with ASD, understanding that there are methods of nonverbal communication. An individual does not have to be verbal in order to provide you feedback, and you can provide feedback to them as well. And also going into details about behavior guidance techniques that can help those specific items. So lesson 7, different types of cerebral palsy are discussed and other types of movement disorders. So we talk about oral motor dysfunction and understanding aspiration risks. This is something that sometimes providers are not as aware of, and that you should make sure that the dentist, especially if they're newly seeing the individual, understands the level of aspiration risk and that it does exist with an individual. Um, and how do you work with that individual in the group home as a DSP, brushing their teeth every day and making sure that you're aware of the risks and protecting them while also being able to care for their teeth. Developing, again, an individualized plan and also supports for movement disorders during oral home care. In lesson 8, we talk about IDD and language and speech disorders. So we do define intellectual disability, understanding the levels of severity and supports needed. So the diagnosis of intellectual disability doesn't mean that the individual absolutely needs support 24 hours a day. There are different levels. Defining types of language disorders and speech disorders, discussing diagnostic overshadowing, which we know, unfortunately, in healthcare, not just in dentistry, but in healthcare. The Joint Commission, I think in 2022, made a big comment on diagnostic overshadowing does exist. Unfortunately, people are, and their behaviors and their symptoms are attributed, unfortunately, to a pre-existing condition instead of having an appropriate evaluation. And the actual issue is overshadowed by that. And so they do not get the diagnosis or care. So it's something to be very aware that happens so that we can avoid it. And understanding nonverbal cues and communication, as I mentioned earlier. So lesson 9, preparing for your dental office visit as a DSP. So if you are calling for the individual, if you are going to be the one coming to the appointment with the individual, what things can you do ahead of time and what things can you do during the visit? So when you get into the office. And so what types of documents should you prepare and bring along with you? Make sure that you have questions prepared so that you know that you can call ahead of time and discuss them prior to attending the appointment. So if there are discussions on identifying, discussing accommodations, those are things that can be put in place before you come into the office. As dentists, we want to know that ahead of time if we can, so that we can make sure that that's provided and that the individual can be comfortable. And there are at-home preparations like different pamphlets. There are things like social stories, and they might even be very specific to the institution where they show pictures of the very specific doctors and staff that work there, all different types of different preparations. Identify support, so people or items or other things that can accompany the resident to the visit that might help them be more comfortable. And so while we put together these videos, we did work with a number of institutions throughout New York State. So we worked with a number of group homes throughout New York State. We also worked with the Anderson Center that was mentioned earlier. And when we did some of our pilot project, what we did was we put together a survey that asked some demographic questions as well as knowledge and attitude questions. We wanted to get a sense of what the DSPs knew already about oral health and providing it. What their attitude was toward, do you think that you're doing a good job? Do you feel nervous that you're not doing a good job? Do you feel like you were prepared or trained in any way to brush someone else's teeth, and so on? And so with these projects, what we did was we provided a pre-survey with these questions for DSPs to take before they viewed the videos. We gave a certain amount of time and it was integrated into their workday to view the videos, and over a certain number of months that they were able to implement what they learned, we gave the same survey again to see if anything had changed. Because we really wanted to get a sense of, is this being helpful to them? Just as a baseline. And so as a result, we did see that it did improve individuals' concepts, their comfort level of, I feel like I am doing a good job. And if you can go to the next slide. So the other thing that was great to see is that our participants did have a strong baseline knowledge when it came to dental care. And they were happy to have these interventions because they were looking for supports on how to effectively do things, but they knew that it was important to begin with, which is very positive to see. So the success of the program was to provide assurance of the caregiver's ability to provide proper oral care when properly trained. There were limitations when we did want to look at sort of a before and after, and this is where we learned firsthand the high turnover rate of caregiver staffing. I think that in our first round, we had maybe 124 DSPs that started with us. And over the course of, I think it was about 4 months, we had about 42 people of those original remaining in those same homes, which is a tremendous percentage of turnover rate. So that's something that, you know, in the backs of our minds, more information about what other data can we collect to better understand why this is happening. I mean, we certainly have some ideas to begin with, but that's for another time. But thankfully, we were able to see that there was success in assurances of the caregivers and why we want to try to implement this as something as a baseline training for individuals as they're moving into working in a group home setting. So how can we help each other? The next step is, you know, what are we missing? How can we help each other expanding training to caregivers, connecting us directly with direct support providers, perhaps in other group homes or in other types of settings that you might be aware of? Advocating for group homes to require trainings for onboarding for caregivers. When we did try to get a sense of what individuals received prior to, it was minimal to none on oral care, which is why, you know, we think it's so important to get this as a requirement. And then please communicate additional needs that we may be able to use this to address it, or some, you know, other program by adopting or scaling our programs that we have going. So I put this out to you to make comments, ask questions. Please let us know your thoughts, and we're very happy to have some discussion with you.
I think, Taylor, I saw in the chat here from Steve about the 2 to 3, 4 year long waiting lists that occur in New York State, and all the horror stories. And, you know, I hate to say that we are aware of this, that I am aware of this, because I wish that they just simply weren't true, but I am aware of the horror that is going on in New York State in terms of individuals not receiving the treatment that they deserve. And I am aware of the Medicaid reimbursement rates, and how abysmal those are, which is why I quite literally sit on the Medicaid committee and advocate for better reimbursement, because better reimbursement turns into better care for the individuals. We are aware too that individuals are struggling to find dentists that will treat individuals with ID, which just boggles both Dr. DiSenso and my minds that it is this hard, because it shouldn't be a rate limiting step, but it is. And I just want to personally also say that I am heartbroken that your son has been on a waiting list for years. And if there's any way that I can help you, will you please reach out to me after this, and reach out to myself and Dr. DiSenso, and we will do what we can to move the needle for you. So I understand everything that you're saying, Steve, and I'm glad that you brought all of these to light, and we'd love to have more of a conversation in any way that we can to help support.
Steve, I see that you mentioned here about bringing this to legislators across the state as well. I'm not sure in what capacity, but I just came back from a conference from the AADMD. I'm not sure if you're familiar with the organization. It's the American Academy of Developmental Medicine and Dentistry. And they have been doing a lot of work with legislators as well. I think more recently, they've been attempting to get reimbursement by advocating for individuals with IDD to be recognized as a medically underserved population, which would then open up the opportunity for more money, but also trying to shift from Medicaid to Medicare. So I don't know if what you are working on and what they are working on may overlap in some way, if you could merge forces, but it's just something to think about. And yes, I mean, I echo Dr. Rozdolski's sentiments that, for your specific situations, we're more than happy to speak with you. But we are always also looking for opportunities to partner, on a level that's going to make a difference outside of just our institution. So please do follow up with us. And if you have any thoughts while we're on the call, please feel free to share.
And then for those of you that are on the call tonight, feel free. Let me actually get to my end slide here so that you can write down. By the way, I should mention too, before we go, that this project, Smiles United, was supported in part by a grant from the Council on Developmental Disabilities. So we could not have done everything that we did without their very generous support and guidance. And thank you all for your time this evening. This is my individual email. This is Dr. DiSenso's individual email. Or if you want to email both of us, you could also email us at Smiles United, as this is our joint email account at Toro. But feel free to snap a picture of that, and please reach out to us, and we would be more than happy to answer any questions, and let us know what you think of the videos if you get a chance to watch them. Are they helpful? Are there things that you would like added? Any other video modules that might be helpful for you or someone that you know? And just any feedback we appreciate, because we do take it seriously and want to know how else we can grow this particular program. Also, Steve, I think you can unmute yourself and you can talk. Yeah, we can talk now, right, Taylor?
Can you hear me?
Yeah,
we can hear you.
Well, I don't want to take a lot of your guys' time. Look, my wife and I have been therapeutic foster parents for decades. Had 178 kids come to our home. I would say probably 175 of them have had not just a few dental issues, major. And when we have to go to court every 6 months for a lot of our kids. And the judge asked us if we have dental work done. Is it because they demand it and they want it done, but we can't get any. We have to, our kids got to get referred to. My house takes therapeutic kids, so which are high needs, usually nonverbal, a lot of autistic kids. And it's hard because the local providers either won't take them. We've had a couple good ones who would take autistic kids and IDD kids, but the Medicaid reimbursement rate was so bad they just couldn't do it anymore. And then on a bigger issue, the ones that do take Medicaid, there's a couple. You're not in their office for 10 minutes and they're telling you to get out. Because the autistic sit in a chair. Many times he's got to be sedated, and so it's difficult to do it. Now, you did mention AADMD. I actually, because I'm a strong advocate, I actually just got on one of their advocacy board of directors. So I am working with them. Do you know Dr. I think her last, I can't think of her last name. She's out of Buffalo. She's the president-elect of
Liz Capral.
I've talked to her, but no, this is a doctor who I've worked with recently on some of this dental stuff where we're trying to get creative because the old way isn't working. we can go down to Albany all day long, and I can bring hundreds of people down there that with these issues, we're not getting anywhere because, like, look, I'm brutally honest, and it's a photo op, and nothing changes. The changes have been done behind the scenes, which is what I just go behind the scenes. I joined AADMD. I'm working. Another really strong advocate in Rochester and I started a statewide podcast. We're going to be addressing this stuff with the dental, and we have the stories because we've been doing this for so long. And not just that, but the members of, I think I mentioned I'm a co-lead for, I don't know if you guys have heard of NIAD. It's a Facebook, it started as a Facebook group during COVID, and it's over 12,000 families now, and it's growing. If I had to guess, 100 a week, 100 families a week. And the reason, and you don't get that a lot where you have family involvement and families that are saying, they get together. I'm in a lot of support groups. It's hard to get, you're lucky to get 10 people at them in my local area. But we have all these people because they're frustrated with the system. It's not working for them. So it doesn't matter if we have 50 providers in our area that deal with autistic kids and IDD and the Life Plan and all these agencies that are out there. And if they can't get services for the kid, and like I mentioned in the chat, we literally had to send 2 kids by ambulance because I took them to the emergency room locally because they had abscesses that were the size of golf balls. And we were lucky to get them to the out in Golisano and Eastman out there. Or if that had burst, we would have had, serious could have happened in our home. And we shouldn't have to go by ambulance, I guess, to get dental work for kids. We couldn't get one locally because even when he was developing the abscess, nobody would take him. He was on a waiting list, nobody would take him. Even the ERs, they won't mess with it. Autistic kid, verbal, he needs to be sedated. They're not touching the kid. And that's unfortunate. So I'm really happy that you guys are doing what you're doing. I would love to talk to you offline with some things that I'd love to have you get on our podcast, which is statewide. You're going to hit a lot of families with what you're trying to do by coming on, or I can get you to NIAID and some stuff with that. With all these families, it's across the state. It's not just where I am in Utica Rome. We're growing like crazy, but it's, look, I'm solution based. I could go on this podcast and blast the system. That's not the answer. I had a one with OPWDD, Carrie Neifeld, several weeks ago. It's almost unheard of for a family member to have a one-on-one meeting with the commissioner. And I was able, and the reason I was able to get is because I go behind the scenes and I have the stories to tell her that she doesn't hear. She doesn't hear this stuff from provider agencies. And I can tell them about the they had to go by ambulance and why it's costing them, the state, actually more money by not being prevented in the first place, which is what I think you guys are trying to show in the slide. So I would love to work with you guys and meet you guys maybe on a Zoom or something like that to see if we can do something going forward.
Absolutely. I welcome that wholeheartedly. So we'll find time, and we absolutely will work together and see what we can do to move the needle in a positive direction, because it takes many loud voices and many stories and the right people's ears. So we're right there with you.
Thank you for what you do. I wish I could have got my 3 daughters. I wish I could have got some of them into the dental pediatric dentistry because I would bury them in work.
I know.
In my area. Those other fields.
Yeah. Well, thank you for being vulnerable and sharing your stories with us. I appreciate that.
Yeah, thank you, Steve. And definitely sounds like conversations to come. Really glad that that we were able to highlight the program. It looks like Elizabeth does have a question in the chat regarding finding dentists that accept insurance for sedation for fillings. Is there a resource out there to be able to utilize that you both might be able to share?
Sure. So Elizabeth, are you in the Albany, or do you live in Albany or in the surrounding area? not sure if she's still.
She is on. I would assume that is, she says yes. Yep.
Said yes.
So then I'm sure you're aware of the significant hospital closures. St. Peter's, for example, they closed their doors. Oh, the unmute button should be like on the lower left of your screen. See if you can. But St. Peter, there you go. Okay, go ahead, Elizabeth. Hi.
Yeah, I mean, I hear Steve's story and my heart definitely goes out. You know, I have friends out near the Rochester area. I have a 19-year-old son, and we had kind of merrily gone along as well as we could his first 19 years just getting the dental cleanings. And I was fortunate enough, I feel thankful for that piece. But now all of a sudden, you know, he's with the pediatric dentist, and then they say, well, yeah, he has a filling he needs done. And well, we're just, you know, if you want us to do it, sure, we'll do the, you know, we have a special office, but oh, the anesthesiologist we work with doesn't take any medical insurance or anything. So, oh, that's just going to be $1,000 out of pocket for you. And I'm like, what? I got dental insurance. I've got medical insurance. He's got the card. And now all of a sudden it's like, it's going to be $500, you know, if I wait for the in-hospital, because the dentist, again, there's always some kind of uncovered fee with insurance.
Where can I ask you what dentist you're seeing right now?
So it was with Where Smiles Grow, and like they said, they've been fabulous with the cleanings, but now my son.
Okay, I have. I how far? I know you're in Albany,
I'll
but
drive
Gloversville. I'm trying. So I have a colleague that works in Gloversville.
Yeah.
His name is Dr. Jake Freed.
Okay.
He recently was credentialed at the Saratoga Hospital, ambulatory surgery hospital there, obviously in Saratoga. Not too far, right? So you could reach out to Dr. Jake Freed. And the other office that I would recommend to you for this would be Dr. Christina Gallo. She's in Albany. She's a pediatric dentist as well. And she does still have block time at St. Peter's. And she might be, so reach out to both of them actually. You can give them my name, you know, that I referred, you know, that I gave the name. I don't know your son. I don't know the individual dental needs, but just that I lectured on something and then I provided the names. So I would reach out to both of them, Dr. Christina Gallo and Dr. Jake Freed. If you cannot find their information, email me and I will give it directly to you. Beyond that, there might be another oral surgery office there in like, I can't remember exactly where in Albany, but they might also contract out with a dentist that could come in and do the dental work while they do the anesthesia. So let me know if you have any trouble and I can try to connect you with more people.
Okay. And yes, and I just, my son also does have a care manager, and she is new and is starting to try to help the best she can to look around the area, because she's from the Utica area, but I think she's doing her best. But, you know, again, hearing, I just don't want it to have to come to like that, you know, you have to wait till it's hospital, like ambulance level.
No, yeah.
To finally get someone to be able to do the work, you know.
Well, I will tell you that the trouble that you're going to experience is going to go back to the anesthesia aspect of it, because the anesthesiologist just cannot get reimbursement from insurance for this. So, and this is what I fight for day in and day out, that the anesthesiologists need reimbursement so that we can decrease our operating room wait list. So that is going to be a struggle. But some of, you know, going to St. Peter's might help. You know, it'll be all hospital fees. So, you know, but it is, I understand, I hear what you're saying. It's very, very hard.
And one other quick question, because when I was sharing my concerns about the anesthesia, I was actually asked if I felt that it would be okay for them to try a rainbow wrap on my son, which, is like, oh, I felt like under the right, local sedation, he may not be aware of it. And then the idea is just to prevent, he moves around a lot, he can't help it. But I know that it's outlawed, I think, in the UK. Any concerns about those techniques, if, because at least then you don't have maybe the, anesthesia itself can be hard on the system.
Dr. DiSenso, can you speak to that at all?
Sure. So the American Academy of Pediatric Dentists is typically the body that I have relied upon for policy on things just like this. So collectively, it's referred to as protective stabilization. And they have documents that, you could look at yourself online too, that dentists can review as guidelines in terms of how do you determine which patient it's appropriate to recommend, what scenarios would be appropriate to recommend, from physical to psychological and so on, because you're right, there are certain situations where that may be an appropriate situation, and other times where it might be identified that this might not be a great idea for this particular individual for this particular case. So I rely very heavily on that, and that's how I educate my students. I know that the AADMD has been working on their medical and dental curriculum as well. So they might have something updated coming out on that also. But there is a lot of literature from the AAPD on that. My recommendation to you for your specific case is to ask as many questions as you can. It sounds like you did already get some information on, why they would want to do it, what would be the implementation, and so on. Just make sure that you understand it and that you're comfortable with it. And they're definitely, I received a lot of training on how to do an evaluation to use that appropriately and for what situations. And so there is that training out there for those who are knowledgeable of it. So hopefully it provides you with some information on it.
Okay. Yeah, wonderful. Thank you for this, this discussion this evening.
You're welcome. And please, if you think of anything that you didn't think of and when we're on the call, please feel free to email us. We love to hear from the community and everywhere in New York State and outside, because, we're really trying to help pool resources, because we're all trying to fight the same fight. And when we're in individual silos, we're not going to make a dent. So, please feel free to reach out to us.
Any other questions before we finish for tonight? And I will echo that you are more than welcome to reach out to myself. I included the link in the chat to our forum post holding feedback form. So if you have any additional questions or have feedback regarding this presentation or future presentations that you would like to see, please feel free to give that information on that form. And we want to make sure that we are covering topics that really mean a lot to the folks that we are looking to serve. But fantastic interaction tonight and really great participation from everyone. So really appreciate that. But I'll open it up to questions for this last little bit if there's anybody who had anything pop up while the conversation was going.
Thank you. Thank you for your time tonight too. And Taylor, thank you for inviting us. It was so nice to meet you. And nice to meet all of you. And I appreciate all of the discussion we had. So thank you. Thank you.
Yes, thank you
Agreed.
both,
Thank
Dr.
you so
DiSenso
much.
and Dr. Rozdolski. We really appreciate your time. And thank you everyone for hopping on tonight. We will be sending out a recording of this offering as well to anyone who was registered, and it will be uploaded onto our website. So if folks were not able to join live tonight, they are more than able to watch the recording, or if you had something that you thought of while you were on the presentation tonight, but it didn't click right away, you're more than welcome to watch that recording and go back through the presentation. So thank you again to our wonderful presenters tonight. And just a shout out that our forums are sponsored by Care Design and Partners Health Plan. So we want to recognize them as well as being supporters of the health work that Special Olympics does. So with that, everyone enjoy the rest of your evening. And we will be sending out this recording as well as additional information about our upcoming forums later this week. Thank you so much.